Today's Health Watch. Did you know you can access your own health records, including test results, as soon as they are available? At first, it might sound like a great idea, but in some cases, people are accessing them and then getting life-changing diagnoses before their doctors have had a chance to review and discuss them with them. So why is this happening? Well, it turns out there's legislation that went into effect in 2021 called the 21st Century Cures Act. The act was designed to give patients easier access to electronic health records and quicker access to medical innovations. But it came with an unintended side effect. Patients can now see information, even serious information like cancer screening results, on their lonesome before a doctor can deliver the news and put it in context. Our chief medical correspondent, Dr. Jon LaPook, joins us now to talk about what patients can do about it. I see the pluses, I see the minuses, right?
Yeah, it is a great idea, but it comes with some wrinkles. I got permission last night from my oldest sister, Judy, to tell this anecdote from a few years ago. It was late at night. Her iPhone dinged, and it had a result of one of the blood tests. And it was a kidney test called BUN, blood urea nitrogen. It was a little bit high, so it said abnormal. Now, it turns out if you're fasting, you get a little dehydrated. That's abnormal, no big deal. And it was no big deal. But she asked, late at night, with her doctor not around, she asked Dr. Google. And by the middle of the night, it's pointing her to renal dialysis sites, kidney transplant sites, and by 7 in the morning, when she finally said, she called me.
Full meltdown.
Full meltdown, she called me. I mean, she was sort of laughing at herself, but also serious, and I said, no, you're fine, and here's why. But it is a good idea, ultimately, because that old thing, especially with paper records, where you say, well, no news is good news. If I don't hear anything, well, that no news may not be good news because maybe the doctor never got the result. Maybe they got the result and didn't read it. Maybe they got the result, read it, and didn't realize it was abnormal. They tried to call you, all that stuff. So it is a good idea, but...
But has it gone too far, and is anything being done to scale it back so that not so much information's out there?
Yeah.
I mean, I see the notes. I'm curious. I'm like, oh, this is what my pediatrician
You're married
said.
to a doctor.
Yeah.
Yeah, but still, I asked Dr. Google a lot, too.
Yeah. Your husband should just rename his last name, change it to Google, and then he would be just asking him. There has been an effort to clarify this, and I actually tried to clarify it with my own hospital, NYU Langone, yesterday, and it is still confusing. A doctor can can say, I don't want these results released, but it has to be because they think that the results will cause the patient to have physical harm to themselves or to somebody else.
That's
not
a high
emotional.
bar.
Not emotional. So it's not just if you get freaked out. The patient also, depending upon the app that they're in, can say, I don't want to see the results. But, you know, you can understand. I had a patient just recently who found out about her breast cancer diagnosis. I was suspicious of it. She was suspicious of it based on the mammography, had a biopsy, and I'm refreshing, and she's refreshing, and she got the result first.
Wow.
And I needed to be able to put it in context.
Dr. LaPook, you have such incredible bedside manner, I'm sure, with your patients. How important is it for a doctor to deliver news like that to a patient rather than them reading it themselves?
Well, it's great.
Like, what are you able to do differently?
I think it's great if you have that conversation, now that we know this is happening, to say, look, let me explain some of these results to you beforehand. You know, here's what's happening. If you get 20 results, some of them, just by luck, are going to be outside the range. Don't freak out about that. And also understand when you have a radiology report, it may say something, there's a 3-millimeter nodule in your lung. That doesn't mean you have cancer. So try to immunize them, try to educate them. But at the end of the day, you need to be available to those patients. They need, my patients can contact me. There's all sorts of ways of doing that. And I think it's just, I love empowering patients. We are in this transition period now where, they're not doctors, they're not clinicians, and we need to educate them. I like that idea of saying, look, let me tell you beforehand what could happen and how to help you interpret the results.
All right, doctor, thank you so much.
Thank you.